Right. My name is Dr. Muhammad Ahmed. I'm 75 years old. I am practicing in UK for the last 46 years as a general medical practitioner. And my special interest is diabetes, which I have recently completed my master's in diabetes. Now, I had implants in the past in UK, two implants, and I felt I needed more implants, but the costing was the main factor, which I decided to come because of my nephew who suggested Dr. Ramaya's clinic, which deals with implants and root canal treatments. As soon as I came, I was quite impressed with Dr. Ramaya, her approach, and the explanation she does to the patient is exactly the same way I do to my patients in UK. So she fits into all the recommendations I had about her, and her clinic is quite comfortable, and the staff are very helpful. And then I had the excellent treatment. I had the root canal treatment in India before, but I found Dr. Ramaya's root canal treatment was excellent, and I'm covered for the pain, and she made sure that I will never have pain, which I don't mind to have any more root canal treatment. As far as the implant is concerned, I had already, as I mentioned before, but the thing is the approach is entirely different in India compared to UK, which I had an experience. Obviously, their method of implant is different than in UK, but the main thing which drew me down to India was the costing. The costing was nearly 60% less than the UK implant. I had already one implant from her, two implants, and I'm quite happy with the treatment I had. First I had the implant put in. Now after 3 months, 4 months I came back, and she followed up properly. She had a re-x-ray and found out the bone development is quite solid, and she went ahead to put the cap for the implant, and obviously the costing was the selection of the tooth was my choice because of the costing. Because of the costing as well as my age, I thought I will go for the 10 years guaranteed tooth, which is quite comfortable, and it's a little bit more costlier than 5 years, but still it is cheaper than in England. England's capping is quite dear. It's nearly 50% more than what I was charged by Dr. Ramaya. And I highly recommend Dr. Ramaya's approach, the treatment, the staff, the explanation to the patient, which is most important, and the costing. She tried to keep down as much as low possible, according to your taste. If you want further reduction in the fees, you go for a cheaper tool. So obviously, she has given me the choice, but I went to my choice. And still I am quite happy and content with her approach and her treatment and her quality of care and follow-up. And she reminds, and the staff also so helpful. Sometimes you forget, and the staff usually remind within 12 hours, 24 hours that your appointment is there, which is more pleasing. And they're quite accommodative. If you are busy, leading a busy life, they always try to change the appointment according to your convenience. So I can't find any faults with the treatment or the approach or the costing of the treatment. And I have already started recommending Dr. Ramaya for her dental care, particularly root canal as well as the implant. So I don't have any further hesitation to give the top class ranking for her treatment and approach. For more implants, I will come back to Ramaya rather than getting treatment in UK.